So I'm Dr. Peter Nakaji, and I'm now sitting with one of my colleagues from plastic surgery who I work closely with because we want to emphasize how important the plastic surgery and reconstruction part of neurosurgery can be. Neurosurgery often happens on very cosmetically sensitive areas, on the head and neck, and that's where a lot of our identity is. And so I think it's very important that we know how to restore things back to normal. And the reality is none of us as neurosurgeons necessarily are the only people who can do that or possibly even do that part the best. So we can work with talented plastic surgery colleagues like my colleague here, Dr. Vasby, who has joined us today to talk about that part of the neurosurgical journey. Yeah, the reason why I thought it was important to have this conversation for the patients is just because, you and I have worked together for many years, and as a plastic surgeon, you brought a lot to the cases and to what we can offer. We've done a lot of cases together, and as a neurosurgeon with plastic surgery interest, I think it's important that people know that there is availability when it matters for plastic surgery and what a plastic surgery can bring to a case. So maybe you could talk a little bit about, your history in plastic surgery in general, and then how it plays into your interest in neurosurgery.
Sure, that sounds great. Yeah, I have a pretty long and extensive background in the surgical field, and so my training goes all the way back to my early days working as a EMT or emergency medical technician and working in surgery as a physician assistant, and then on to complete general surgery and then plastics. And so it's a long, almost 2-decade career of training and working with hundreds of different colleagues throughout the country in areas of expertise. And I had a strong interest working with my neurosurgery colleagues doing these complex craniofacial or head and neck and the spine cases where we were trying to optimize the outcome of the patients, both on not just functional from a neurosurgical standpoint, but how was their overall appearance. And so, for example, plastics or plastic surgery comes from the Greek word plastikos, which means to mold or to shape. And so that's really the foundation of what my background is in. So working with my colleagues such as yourself in neurosurgery, I found that the patients can have some outstanding outcomes working in combination in these complex multidisciplinary surgeries.
Yeah, I think that for many people, plastic surgery, think of it as cosmetic surgery. And there's no question in my mind, I think that part is really important. That if we're going to do beautiful work on the inside, why shouldn't it be reflected on the beautiful work we've done on the outside? And I don't think that there's anything less about thinking about that part of it for patients. And obviously we know, you and I know from talking to many patients, that they really care about that part. I don't know if the average person thinks as much about the reconstruction part. Like the cases where maybe there's been radiation before, maybe there's already been surgery, maybe there are healing problems or infection from before. Can you talk a little bit about that part and what's the plastic part of that?
Sure. So when you're right, a lot of people, when they think about plastic surgery, they think about the cosmetics, and the cosmetic arm, and what we think about, that's taking you from a normal state and making you better. What happens with a lot of patients who've had surgery or have had neurosurgery, they're going from an abnormal state or things that are not really what they used to be, and we're bringing them back to a normal state. So that's the reconstructive arm of it. So taking our patients and doing what we can to give them the best outcome to bring them back to a normal state or even better. So working with our neurosurgery patients, when I get consulted or when we work together, we're really working on utilizing my areas of expertise along with yours and giving those patients the best outcome. So for example, utilizing maybe different surgical techniques to move the skin and soft tissue around. Maybe those patients have had a history of, for example, as you said, radiation or going to have radiation. Maybe they've had previous surgery and there's some scarring or missing hair. Or as you know, a common issue is that they're having a defect where there's an abnormality or shape of their skull or the surrounding muscle and tissue. And so by us working together as a team, patients really feel they'll get the best outcome for their final, not just the main portion of your surgery, but how does it aesthetically or how does it appear afterwards? So they're not really as conscious about the final outcome.
Yeah, I've really seen that. I benefited a lot from seeing the techniques, and the training for most neurosurgeons doesn't include a lot of this. So when you've come and really mobilized tissues, brought them together better, made them look better, that's been very valuable to me, and I know the patients have really appreciated it. And in many cases, it's been much safer for the patient because, as we know, if they're going to have a risk of leaking spinal fluid or other kinds of problems like that, getting a better closure literally can be life-saving for them. And then what about the big cases? Somebody has a major trauma and is missing a large piece of bone and all that. These are cases where sometimes we'll work together to reconstruct. What's your perspective on that?
Sure. So again, when we talk about what plastic surgery does, or people like myself who have an interest in the craniofacial or the head and neck portion or portion of the spine, sometimes injuries happen where the patients lose, for example, not just their injury, but they may lose a piece of bone or a large piece of bone or segments around their eye, their face, their jaw, their skull. And so we're able to reshape or reform or create it with either their own tissue or synthetic tissue to help reconstruct or rebuild it back to a more normal state. And working in conjunction with yourself and our neurosurgery colleagues, bringing the patient back to a normal state or even better than they were before. And we can utilize other therapies that we enjoy to give them best outcomes, such as topical skin treatments and scar treatments, the use of hyperbaric therapies, the use of topical silicone treatments, and then really walk those patients through all the things they can do from a nutrition standpoint and from a minimizing scar healing standpoint with prevention of sun, prevention of smoking, all these things that can really give them the best surgical outcome.
Yeah, I really enjoyed seeing that part because those are things obviously we as neurosurgeons don't typically offer. We don't really think about that, or if we do, we just send it off to plastic surgery and hope for the best. But having it together in a combined team has really been a huge advantage, I think. So, I mean, there are many cases, of course, where you may do something which is plastic and reconstructive that doesn't require us, but I think there's probably been some advantage to having the neurosurgical background and experience. I mean, it kind of extends what you can do. I know for me, it's the same way that having spent a lot of time with you and other talented plastic surgeons over the years, and now working together, it really lends something to every case that we do it better. But some patients are specifically going to have reasons why. Maybe they had a big opening and we're going to do a small opening, but now we have to restore some of what happened before, or we're going to work together. If people want to have the plastic surgeon involved, what do you think they need to do?
Well, I think utilizing people such as yourself who have an expertise in these areas of the head and neck with these complex issues, and you see a lot of patients who had a lot of problems in the past, or they've had some complexities, maybe previous surgeries, and I think us working together to really not only give those patients the best aesthetic outcome or give them the best results on the outside, you have this expertise of the brain, skull, and the surrounding tissue, and we can work together to really follow that patient through the whole process so that it gives the patient a sense of comfort knowing that there's a multidisciplinary, there's a team approach, and that we're really looking at the overall outcome for the patient.
Yeah, there's no question that these patients face a number of challenges we talked about before. Pain, in some cases deformity, it's kind of a rough word, but things are not of the right shape, and then functional challenges. Maybe you can't chew right, maybe your eye isn't opening, closing properly, those kinds of things. One of the concerns is will this be something that's considered cosmetic and not covered by insurance? But what's your experience then with that?
Yeah, that's a great question. I think we see the patients that come and see either myself or yourself for these areas that they've had previous issues, as you described before, the pain, deformity, maybe they have functionality problems. Insurance companies have actually been pretty good, and especially when we are able to work with the patient and really define what their problems have been and articulate that and work with them and their insurance company. By the time they come see us, where our areas of expertise come together, I think most insurance companies have been very open to having that patient get the help they need and the services.
Yeah, that's been my experience too. I think they want to help, and if they see those problems, they realize it's not just pure cosmetics, and that if there's something medical which has led to them needing to be, the patient being restored, it seems like that they're pretty good about, helping everybody get. And certainly our sympathies are there. I think long gone are the days where we would just say, look, you're just lucky to have gotten through brain surgery, good luck from here. I think we understand that people want to get looking and feeling at their best.
Yeah, I think that with the advent of the technology and the latest, the overall treatment of our patients today are far better. And we now know that there are many opportunities for us to help the patients improve what their maybe original surgery or what the initial intervention is. We really can have them have an outstanding result working in a collaborative or team approach.
Yeah, and because for us as neurosurgeons, we don't get to choose where the problem comes up in the head. Sometimes it does require a little Botox to balance things out, maybe a filler somewhere, maybe an actual implant, maybe transferring of tissue, fat or other tissue to different parts of the body. And I would think these are expertise areas that are obviously your areas. Also, all the wound healing adjuncts, all the things that wound clinics offer that are just not part of the normal thing. And sometimes even little add-ons that people want just because they really want that scar to be the very minimal possible. Those are all great things to be able to offer. Anything else you think our patients should know?
I think them reaching out and just, I think, having some questions to come and discuss the options. So whenever they think about having it surgery, it's a serious discussion and it's a big choice. When you're having neurosurgery, there's a lot of anxiety, a lot of stress, and we want patients to know that we work as a team in collaboration, and we're going to discuss not just the major surgery, which obviously takes precedence, but we're going to walk you through that whole process. And someone like myself will hold their hand as when you're doing these surgeries, and there may be issues throughout the way, that we're going to be there for them, and we're going to be able to help them with the process to give them the best outcome. And at least they know they have people to lean onto throughout the process. And I think that's a big concern for a lot of patients, is that once they have surgery, they sometimes feel alone or they'll turn to the internet. I think with us working together and with our team, I think patients will feel there's many opportunities for them to come in and we're always available to them.
Yeah, I think that's really important, that people don't feel somehow embarrassed or feel like it's not part of the discussion that we're willing to have. That yes, your brain, your function, the outcome of surgery is the most important thing. But for sure, all of these things are just as important, and it's very reasonable to have these kind of concerns. And as you know, for many years now, we've been not cutting off all the hair. We've been braiding there. We've been hiding incisions. We've been working through the eyebrow or through the eyelid, or, making these tiny openings that maybe not everybody does. But in the end, that's given patients sometimes a chance to have a neurosurgery that you can't really even see. And sometimes when they've had a much bigger procedure somewhere else, it's been a chance to put it back to where it used to be so that they can feel like themselves again.
Yeah. And that's always been, taking care of the patient and making sure their underlying neurosurgical problem is addressed and making sure they have a phenomenal outcome. But you've always been very cognizant of the overall approach. And that's something a lot of patients don't understand and they don't know. And that's maybe something that us as surgeons, when we work in collaboration, we really think about the total patient and really approaching them in a holistic way, not just thinking about there's a problem, let's operate on it. We're really looking at the overall functionality and how the patient will feel before and after. And you've been great about making sure to minimize scarring, minimize removal of hair, and giving them not just an outstanding outcome, but being conscientious about how they will feel throughout the process.
Yeah, well, I've been very fortunate to work with really talented people. That makes it so much easier, and to try to learn the whole time. And I'm really thankful for all the cases we've got to do together, and we'll get to do together, because I learn something every time about how to make people look better, feel better, be better. And I know that that's what patients want. And so, yeah, I thank you very much for that.
Yes.
Well, we'll keep it up.